Pregnancy can make you more likely to experience heartburn, and spicy foods may make those symptoms worse because these foods can carry bacteria, parasites, or harmful substances that may cause serious infections or affect your baby's development. Too much caffeine has been linked to an increased risk of pregnancy complications. During pregnancy, most women need about 70 to 100 grams of protein each day, depending on their weight and the stage of pregnancy. Pregnancy isn't about perfection, it's about making healthy choices most of the time. Hello everyone, and welcome back to Dr. Paul's Health and Wellness System. Last week, we talked about the early signs of pregnancy and how to recognize and manage them. If you haven't watched that episode yet, be sure to check it out after you're done with today's episode. I'm Dr. Paul, and I'm delighted to have you with me today. If you're pregnant, you've probably wondered, can I drink coffee? Is spicy food safe? Should I avoid sugar? Which fruits and vegetables are best for my baby? If you've asked any of these questions, you're not alone. These are some of the most common concerns expectant mothers have. And today I'll be answering them one by one in a simple, practical way that anyone can understand. Remember, during pregnancy, every meal is an opportunity to nourish both you and your growing baby. The foods you choose today can support your baby's healthy growth while helping you stay strong and healthy throughout your pregnancy. So, whether you're relaxing at home, on your way to work, or simply taking a break, I'm glad you're here. Let's dive into today's episode, Food During Pregnancy. Let's get started. This is one of the most important questions every pregnant woman should ask. During pregnancy, avoid raw or undercooked meat, raw fish like sushi, raw eggs, unpasteurized milk and cheese, alcohol, and fish that are high in mercury, such as shark, swordfish, and king mackerel. Why? Because these foods can carry bacteria, parasites, or harmful substances that may cause serious infections or affect your baby's development. My advice is simple. If you're not sure a food is safe, cook it properly or leave it out until after pregnancy. It's always better to be safe than sorry. Yes, you can. Spicy food does not harm your baby. The baby is well protected inside the womb. However, pregnancy can make you more likely to experience heartburn, acid reflux, or stomach discomfort, and spicy foods may make those symptoms worse. So if spicy food doesn't bother you, enjoy it in moderation. But if it gives you heartburn, it's best to reduce the amount. Yes, but keep it moderate. Most experts recommend limiting caffeine to about 200 milligrams per day. That's roughly one regular cup of coffee. Too much caffeine has been linked to an increased risk of pregnancy complications, including miscarriage and low birth weight. Remember, caffeine is also found in tea, energy drink, chocolate, and some soft drinks, so count those too. I always tell my patients to eat a variety of fruits instead of relying on just one. Some excellent choices include oranges, apples, bananas, berries, mangoes, avocados, and watermelon. These fruits provide vitamins, minerals, fiber, antioxidants, and plenty of water to keep both you and your baby healthy. The more colorful your fruit choices are, the more nutrients you're likely getting. Dark green vegetables are some of the best foods you can eat during pregnancy. Spinach, broccoli, kale, pumpkin leaves, carrots, bell peppers, and sweet potatoes are all excellent choices. They contain folate, iron, calcium, vitamin A, and many other nutrients that support your baby's growth and your own health. Aim to include vegetables in your meals every day. I would encourage you to limit it. Most sodas contain a lot of sugar and sometimes caffeine, but very little nutrition. Drinking too much soda can increase your risk of excessive weight gain and gestational diabetes. Water, milk, or fresh fruit-infused water are much healthier choices for you and your baby. Yes, occasionally, but it shouldn't become a habit. Fast foods are often high in salt, unhealthy fats, and calories, while being low in the nutrients your baby needs. If you're craving fast food once in a while, that's okay. Just try to balance it with plenty of nutritious meals throughout the week. Pregnancy isn't about perfection, it's about making healthy choices most of the time. Not all herbal teas are safe during pregnancy. Some herbs may stimulate the uterus or interact with pregnancy in ways that aren't safe. That's why I always recommend checking with your healthcare provider before drinking any herbal tea, even if it's labeled as natural. Remember, natural doesn't always mean safe during pregnancy. You don't have to avoid sugar completely, but you should definitely limit it. Too much sugar can increase your risk of gestational diabetes, unhealthy weight gain, and may affect your overall health. Instead of sugary snacks, try fruits, yogurt, or healthy homemade snacks whenever possible. Your body and your baby will thank you. Constipation is very common during pregnancy, but your diet can really help. Eat more fiber-rich foods like oats, whole grains, beans, fruits, vegetables, and prunes. Most importantly, drink plenty of water every day because fiber works best when your body is well hydrated. And don't forget to stay active. Even a daily walk can help keep your bowels moving. A healthy brain starts with good nutrition. Foods rich in omega-3 fatty acids, especially DHA, are excellent for your baby's brain development. Good choices include low-mercury fish like salmon and sardines, eggs, walnuts, chia seeds, flax seeds, and foods fortified with DHA. Also make sure you're getting enough iodine, iron, folate, and choline because these nutrients are all important for healthy brain development. During pregnancy, most women need about 70 to 100 grams of protein each day, depending on their weight and the stage of pregnancy. Protein helps build your baby's muscles, organs, brain, and other body tissues. It also supports your placenta and your own changing body. Good sources include eggs, fish, chicken, lean meat, beans, lentils, milk, yogurt, cheese, tofu, and nuts. Try to include a source of protein with every meal instead of eating it all at once. Remember, pregnancy isn't about eating perfectly, it's about eating wisely. Small, healthy choices every day can make a big difference for both you and your baby. If you enjoyed today's episode, leave your questions in the comments because your question might be the next one we answer. And don't forget to follow and subscribe to Dr. Paul's Health Tips for trusted pregnancy advice that helps you have a healthier pregnancy and a healthier baby.